For a week and a half, Alan Gorlick and Heather Denbour have been fighting to get his mom care. Instead, they've slowly been watching the 89-year-old deteriorate inside the emergency room at the Grace Hospital.
It's really sad to see them waiting for that long in curtain areas with no privacy and the noise and the sound. It's very upsetting for them.
Denbour's mother-in-law had a fall at her home last week. By the next day, she couldn't stand up. Helen was rushed to hospital, triaged, admitted, and left waiting.
The wait time was 18 hours until she saw a doctor that night.
But that was just the start. She spent the next 8 days on a stretcher in the emergency room. No privacy, unable to stand and bear any weight or use the washroom on her own.
She's lost a lot of her strength. She's lost a little bit of her spirit.
While Helen has no broken bones, she needs rehab treatment to help regain her mobility. It took until Wednesday afternoon for a bed to open up at Misericordia.
You see your mother-in-law, who you've known for almost 40 years, kind of slumped down and looking like that. You know that it's draining for them.
The family says at least 7 other seniors were in the same position.
You could see that the halls of the ER were lined with a lot of elderly patients, makeshift beds in the halls, and the staff basically you could see them being overworked.
Uzoma Asagwara, the NDP health minister, calls the situation troubling and concerning.
It's unacceptable, quite frankly. And I know that healthcare workers are doing their absolute best to provide the care that they know Manitobans deserve. But obviously the conditions are incredibly challenging.
They are working to improve the system and wait times, but it takes time, and they're asking for patience. For Gorlick's family, changes can't come soon enough.
These people can't languish in hallways waiting for some place to go while they're hopefully trying to get home again.
Brittany Greenslade, CBC News, Winnipeg.